experts just mentioned that, in fact, it will be recorded, so others can always rewatch it. So I'd just like to offer a brief introduction and thanks to Lisa Marceau and Julia Coleman for joining us. Lisa Marceau is the Staff Vice President of Digital Research Solutions at Anthem. She's been working in the field of digital health strategies and health research for the past 20 or actually over 20 years. She specializes in investigating the emerging influence of generations of people who've grown up with digital technology on health and on building strategies to bridge current and future needs of healthcare consumers. Julia Coleman is a senior program manager at HealthCore. She has over 10 years experience in the field and specializes in building and evaluating digital health products, many of which have gone on to win awards. She manages innovative research studies and leads branding, marketing, and recruitment and retention efforts for clinical trials. So today, Lisa and Julia will be talking about recruitment and retention from a human-centered perspective, including case studies that focus on varying study designs that are targeting populations that differ in their use of and familiarity with digital technology. So thank you once again, and I look forward to hearing your talk.
Great, and thank you so much for joining us today. So I'm going to dive in, and Julia and I will walk through this together. So moving to the next slide. The goal of the presentation today is really about being human-centered in research, and that requires that we think outside ourselves and our experiences so that we can better understand and engage our intended participant audiences. So this presentation is really intended to broaden our thinking about research and our relationship to participants to improve recruitment, retention, and maintenance in the field. So we're going to take what we already know and what we've learned about research over the years in the process and refocus that lens to think differently about participants. We're going to talk about how this simple yet significant shift from a participant as data, and think about your first patient in, your end goal of last participant in, or your sample size of N equals 450, to the people behind those numbers, which can make research, recruitment, engagement, and retention more impactful. So let's get started. Next slide. So we are all familiar with the research process, right? This is a very familiar linear graph, I think, what we've put in every proposal. We develop a hypothesis, we create our study design, that drives our sample size and our population. These decisions dictate what kind of data we're collecting and how we collect it. And once we've successfully, hopefully, and that's what we'll talk about today, collected the data, we analyze and report on it. And we can write and repurpose and regurgitate these steps in our sleep. And then when we're in a proposal season in particular, it's just a copy and paste type of activity in a lot of ways. But as we get to the summarize and reporting phase, we are also all familiar with the limitations section of a manuscript. Did we meet our recruitment goals? Did we have a representative sample? Did we see a lot of dropout? And this can really change the impact of our findings. Although it varies by condition and population, between 1/4 and 3/4 of all trials fail to meet recruitment goals. This impact has a skipping stones effect. We're going to talk a little bit about that. Next slide. The obvious impact is resources, right? The question is whether there's enough funding to continue. And where will the funding be redirected from if it does? And perhaps the stone in that instance goes kerplunk. The team is a second area of concern when our recruitment starts to falter. So in example 1, the RED project, the question is the team able to continue on the project, or do they have other commitments? Are there other projects they have said they would join once this one ends? And in this example, the delays could keep the staff from moving to another project that they would have otherwise committed to. Or they will leave this project now in an extension year without sufficient staff to support the effort. And then we have to consider study team morale. Do the team members feel pressured to meet difficult or impossible targets? Are they demoralized that the study can't continue? And these are the expanding rings that you see getting lighter and thinner the farther away and how they overlap in the different scenarios. In the blue example, there's another challenge. These are the opportunity costs at the project level. What future studies can't be started while this one continues? What research can't be done because these data weren't collected? Other ripple effects that we have to consider of recruitment delays include the impact on the community. Maybe we've gotten community involvement, we have advisory or other research partners, and they've all been engaged and may have expectations. What is the impact on them? And most importantly, and this is kind of why we do what we do, did we miss an opportunity to inform the field of public health in a meaningful way? If the study can't recruit, will we be able to measure what we intended? Will we need to change the outcomes, or worse, not report outcomes at all? So there are many factors and that can contribute to this struggling recruitment plan. And we're going to focus on the most important and the most addressable one of all. And it starts with thinking about the research process a little bit differently. So next slide. In this diagram, the steps are the same. We start with discovery. What's the problem being solved? We define our research question or create the hypotheses. We establish the details of our study. We create a sample size, recruitment plan, and details of the protocol. We implement, and then we recruit to collect our data. Finally, we get to the data analyze and report step. The difference you'll see in this process is that it's not linear, it is continuous, and we keep the participant at the center of every step, and we continue to review and revisit so we can revise in meaningful ways throughout the process instead of hitting a point where the study has missed its target and we need to regroup. This makes sure you know your audience in every step. Next slide. It sounds pretty simple, know your audience. And now you're all kind of thinking, is this why we're here, to learn that audience is important? Yeah, we all know that as researchers, right? No, it's actually to challenge you to think about that audience differently. And this will drive how you think about your research processes differently. And as I said in the beginning, we are going to change them from numbers to people. We often leave the importance of the participant to the statistician to tell us what sample size is going to be, or we say, what number do we need to get to for statistical significance? But take a step back and think about flipping that script. Think about who your audience really is before you start writing a word on your proposal. Understanding your audience has to be the very first step because it is the who and the why behind your research question. Who is going to be impacted by the research outcomes? Why do you want to learn about this study, this question, and this population? It seems like a fundamental principle, but we get wrapped up in the chaos of like creating grants, study designs, outcomes, instruments, the how-tos, and then we forget that this is the who and the why. So no study is successful without them. And that's really what we have to keep in mind. So next slide. So how do we do this? To think about your participant in a new way, put yourself in their shoes and research the demographic. Think about the examples of real people who are going to be invited. This is fundamental, but it's also one of the things we forget in the whirlwind of putting in a proposal and starting up a study. The basic act of resetting our own expectations means we start from the proposal stage to really understand what will work and what won't in the participant demographic from the moment we think about recruitment all the way through the study end. So if we take time to clearly define the details of our audience and think who they are, many of the decisions in the grant development process become clearer. For example, who are the participants? And this is the standard demographic stuff we know: age, gender, race, ethnicity, socioeconomic status, social support, all of that stuff we always consider upfront, right? But let's say for this example, we're talking about an older male HIV positive audience. So next we have to think about, what are you expecting of them and how often are you engaging? So what's their ability to travel? What's their time commitment? What's the technology use? How complex is it? What's the cultural aspects? So let's say this audience that we've defined needs to come to a clinic at baseline, and they're going to come back once per year, and then they're going to answer monthly surveys online. So now we have an in-person and some sort of online component. Where will the participants be? So is it clinic-based, or is it emergency department? Is it in community or at home? And this is these are important factors to consider. But we also have to think about regional diversity, urban versus rural, because these create different norms and expectations of our audience. So let's say we're going to do within 50 miles of Boston. So the next thing we have to think about is, when will you interact with them? Is it going to be on their terms, or is it going to be during certain hours? Is it virtual or in person? And is it going to be evenings, weekends, short-term, long-term? All of these kind of complexities that we have to consider, and whether it will be in their language or in English only. So for this example we're using, why don't we say clinic hours, on their own time, English, Spanish, and Cape Verdean. So these details are the ones that go in your proposal and your protocol. Are you imagining a table or a chart in these documents? Or do you imagine your actual audience? Next slide. This is an older male HIV positive audience within 50 miles of Boston, and it could be any one of these individuals. They are similar in their demographic characteristics, but they're very different individually with different challenges, biases, or preferences. Understanding this diversity within our research categorizations means that we have to think about the details of how we recruit and engage with them more specifically. For example, we might have an elderly gentleman who has difficulty walking. We may have a gentleman who is a physician, rural or urban, different types of work. They may be retired or not. And these are all the things that we have to understand in different ways before we engage. Next slide.
So, as Lisa just noted, putting yourself in your participants' shoes and really thinking about the who, what, where, and when helps you set that stage for defining your study's research approach and developing appropriate recruitment methods. Of course, there's no one right answer. As you saw, even within an older male HIV positive audience, there are a range of strategies you may need to employ to reach each of those people. It's rarely one size fits all. But you should think about selecting recruitment methods in the same way you might determine the appropriate research methods for your study. I'd argue thinking about how you're going to reach your potential participants should come hand in hand with determining the study design. That is, right at the very beginning of the planning process. Defining and understanding your audience is critical for making sure that the research design is feasible, and this goes hand in hand with what recruitment methods might be necessary and possible to meet the needs of that study population. If these two things don't work together, study recruitment will be a challenge. Going through the exercise of defining your audience in detail up front really helps you think about the details of recruitment in more nuanced ways. People that think advertising for a research study is somehow different, perhaps special or sacred compared to advertising for, say, headphones or fast food or even pharmaceuticals. But there's so much in common with some of these more standard advertisements than you might think. Lisa's going to talk about this later. But of course, you know that your call to action is going to be join the study instead of buy this or ask about that. But thinking about your audience as consumers is a great approach to start. That said, your call to action, join the study, is going to require significant effort on the part of your participants, and you may be looking for a needle in the haystack, especially if your study design is going to require participants to be referred by specific study sites, if you're identifying a rare or hard-to-reach population, or if there are otherwise a complex series of steps that are going to be required to get your participants to actually join and enroll in the study. There are a whole lot of expensive, fancy tools that aren't necessarily going to drive this action. We get excited about, say, bus or subway ads or a WebMD campaign. But while there can be a real draw to creating a highly visible, engaging recruitment campaign, using these exciting advertising tools to recruit in some cases can be part of an effective strategy, but you have to think about the where of your potential participants as real people out in the world. So I want to walk through some real examples of why understanding the audience early and keeping them in the front of your mind throughout the study really matters. In this first example, let's look at how really understanding participant demographics beyond the numbers was critical to the study success. In presentations and manuscripts related to this study, we described the population as something like 260 males with a urologic condition recruited in the Boston metro area, age 65 and up, about 33% Black, 33% Hispanic, 33% white. And this makes sense, as Lisa said, in a table for presenting study findings. But when we began the study, we took the whole person perspective and described the population with more specificity as an ethnically diverse, older male audience with predefined urologic conditions, which requires in-person visits to a local inner-city hospital multiple times during the study. Enrollment at that first clinic visit will require testing. Activities will occur during regular daytime clinic hours, and they'll be required to attend an hour-long appointment at each time. Between visits, they're going to receive communications and reminders. And what we started to uncover was the challenges that might be presented by conducting this research. Challenges of transportation for an older audience. We thought about how people with urologic conditions may be reluctant to go to a clinic visit if the travel was too difficult or would take too long. Thought about how older participants might not be comfortable with receiving reminders via email or may forget about an appointment if all they've received is a phone call. And so based on these factors, we worked with the study team to, where it was possible, modify and adapt the study design and communication plans to allow for in-home telephone follow-up at some time points, added an additional study site on the other side of the city to reduce travel time, and made sure to do both phone and mail reminders. Additional effort and thought is often required to address some of those whole person challenges. But we can try to better plan and address logistic considerations, adding more study sites, providing travel vouchers, addressing the anxiety, think about what can be done at home. When you take a more holistic approach and think through these things at the outset, you start to identify the other challenges and needs and considerations for your participants, and you can plan for those associated costs, staffing needs, and try to mitigate some of these challenges before they occur. But it goes beyond that. We can do our best to make assumptions about the study demographic, but we have to actually test it and ask the right questions to make sure we're right before we invest too far down that path. Far too often, we design our strategies based on these assumptions only to find out things aren't working as expected or there's some kind of caveat we didn't recognize. And doing the work upfront to ask can save time and resources. In a few minutes, I'll share some of the ways, formal and informal, that asking the right questions of the right people can make a difference. But in this example, it's one where we conducted a study of mental health counselors who treated PTSD with the goal of developing a mobile training program of best practices for evidence-based treatment. And we did our due diligence. We understood the demographics. We read the available research on how clinicians and others in our demographic interact with technology. But we didn't just move forward on that assumption. We started by conducting a modest qualitative assessment with our study population to test assumptions about the intervention and possible survey design. And what we found was our research was correct. Most of our audience did use smartphones in their day-to-day, but we were wrong in one very important way. Our participants wanted to engage with the training intervention we were building on their desktop, not mobile. They were going to use it between clinic patients when they were already at their desk, and they really wanted to be able to print handouts and other resources from their computer. If we'd built the app based on the data that we'd seen that people wanted smartphones, we wouldn't have met their needs. Our recruitment might have succeeded, but our engagement with the intervention, its long-term success, and our retention in the study may have failed if we didn't consider how they wanted to connect to and receive our program. Finally, even when the data, the demographics, all the preliminary research match up, there's still more to learn from our audience. And one great example of this is around the use of social media. So before I dive into the example, I just want to talk about social media in general for a minute. It can be an incredibly effective tool for reaching a wide variety of populations across diverse demographics, depending on the goal, when, who, what, where, and how social media are being used. Data shows social media use is now nearly ubiquitous across a wide range of audiences, except maybe those 65 and up, and those, especially after COVID, are increasing too. But social media is not one thing. It's not just one platform, and it doesn't make sense in all situations, especially for some kinds of sensitive topics in some audiences. And there are a number of considerations on how to approach it. The most obvious consideration when thinking about possible platforms is age. Older audiences may be more reluctant to engage, but many adults are on Facebook or Twitter. Younger audiences might be on Snapchat, TikTok, or Discord, and Instagram might cross over. And so you need to think about some social media platforms you might be less familiar with in order to meet your audience where they are. You should think more broadly about your audience and how they want to receive communications too. Older participants are accustomed to text mail or email. But for the most part, nobody under 30 will answer an email. Nobody under 20 is going to answer a phone call, ever, or even set up a voicemail for you to leave study messages that you might plan. And so as researchers, we need to recognize that our understanding and comfort with communications, social media, might not be the same as our audience, and we need to think about them and what they want. So that brings me to this example. Just because our participants use these tools doesn't mean there aren't caveats. For instance, does your audience have concerns about data rates or messaging limits, or is their data going to be intermittent? Is it an audience that's going to expect instant response if you send a text messages, or will it take them a few days to get back to you if you send an email? Are they going to answer your phone call? In a recent study on postpartum self-care, we conducted a needs assessment, qualitative focus groups, with about 20 members of our target audience. They were Black and brown postpartum women, and the goal was really to understand how we could build this tool. But what we learned was that our study communication strategy wasn't going to work. Our participants were mostly on maternity leave and were not checking their email. And so as a result, we moved entirely to text messaging platform to conduct all of our recruitment and study communications. And learning this upfront, that they weren't going to answer our emails, allowed us to consider the IRB and confidentiality implications, as well as data limits and other challenges our audience might experience. And all of this is to say, making assumptions simply reinforces that we don't know what we don't know, and it's important to want to learn the ways we might be wrong. As researchers, this actually comes pretty naturally for us, and there's always a way to build in some form of asking early on. And that opportunity cost, if we don't, is significant. So before I talk about asking, I just want to mention IRB considerations. I mentioned the IRB a minute ago, and this is one of the most common questions that our team and others raise when we start talking about advertising and digital recruitment. What about the IRB? First, consider them one of your most valuable partners and approach them early and often with study questions and considerations. They can help you ensure that your approaches are sound. Especially when thinking about advertising and communications using new platforms, it's important to map out your plans, and wherever possible, I recommend creating mock-ups to show visually how your materials are going to appear to your participants, annotate those study materials where you need to explain how your strategy is going to be deployed with context, and just like you may be less familiar with these approaches, recognize that they may be as well, and if you are able to adequately explain them, they will be open to them too. So sometimes I will say we start by drafting the messaging first. Let's worry about the design later. But especially on digital platforms, I would urge you to think about the design, content, and platform logistics all together. There are things that you might not be considering, like word count limits or required fields like headlines or places where links are going to go. And if you think about these all together, you can avoid unnecessary edits and going back to the IRB later to make the content match the platform. So one last word on IRB, finally, in all of this. We've had to make a lot of adjustments in our ongoing projects this past year, go back to them with changes as we move to a digital approach given COVID. And things have really changed. While these changes might not have been ideal, I would say let's all leverage the learnings from the past year, what worked and didn't work, as we look ahead. So, back to asking. How do we learn all of this important information about our audience? It comes down to asking, and it's important to build that into your timeline. It doesn't have to be expensive or add years to a study. It can actually save time and costs, resulting, as Lisa said, from those ripple effects of an inability to recruit and retain if you don't. And you can do this early on while you're developing other parts of the study. If you plan for it and think about it early, you can conduct early stage research activities while a larger protocol is being developed. And it can create an interesting publishable set of data, but it doesn't have to. You just have to right size it for your project goals. And asking, there's a number of people to ask. Ask your team members. Engage them more in the research process. Bring them in and ask them to think about it from different perspectives. Everyone brings their own perspective, adds value to the project. Bring in vendors and subcontracts too, who you might not typically engage with until further along in the process. Ask other colleagues. Collaborate. They may have had similar experiences, lessons learned to share. Ask your target audience. Talk to the people that you'll be doing research with as early and often as possible. They are your most important stakeholder. Build them into the research, bring them to the table, and create advisory boards when possible. Ask experts of all kinds, clinical experts, other researchers, your funding sponsor, design and marketing professionals. And something that we love to do is if advocacy groups exist for the condition that you're working in, leverage and collaborate with them and their expertise to bring advocates for this condition into the process. And always ask for a fresh perspective. Who haven't you talked to? Lisa, you're muted.
See that? Yep. So sorry about that. So as Julie was just mentioning, there's a lot to consider. So it also means that there are a range of team members to consider when you think about the participants from a human-centered perspective. And when we think about those participants early in the process and how to engage them, then the team you actually need becomes clearer. So if we consider in this example, if we consider that recruitment is a form of marketing, and I'll talk a little bit about that in a minute, we can bring on team members who are internal or external who have the skills to engage participants in the way that participants expect to be reached. So in this diagram, research is obviously the essential center component. It's why we're here. And our research teams have necessary skills and experience to execute the study. So those are fairly standard and understandable. But we also need this outer ring of skills on our team that take complex research concepts and make them digestible to a participant who is a consumer. There are excellent marketing and communications and brand strategy teams that have a keen understanding of health research and are committed to human-centered design and engagement. So be open to adding team members that include perspectives you are unfamiliar with and possibly sound completely unusual. Just like a statistician or an epidemiologist, an art director or a design strategist can bring a perspective you need and a skill that researchers typically don't have. So you also need tools, and these tools are the things that you're going to share with your participant, whether it's in print or through advertising or social media. And the term marketing materials don't have to be fancy, they don't have to be expensive. They have to meet the need of the audience. They have to meet the need of your participant. They need to be clear and simple, and they need to be targeted and designed in a way that will connect with your audience. So starting early to involve the right team means that you're going to incorporate insights in your protocol and in your IRB materials to save time and avoid resubmission without the time consuming revisions that Julie was referencing. So next slide is bringing us to the idea of marketing as a component of research. So if you consider the definition of marketing, the goal is to create value for consumers so they buy a product or service. And it's been considered in the, in over my years of research, it's been considered kind of a dirty word. We don't market and things like that. But for researchers, recruitment is providing value to establish a willingness to participate. There's little daylight these days between a consumer and a participant as far as who they are. Think of it like this. The person you are recruiting for your study is also deciding between those headphones that Julia was mentioning, or which brand of bread to buy. They're trying to decide which store to shop at or which online service is better. They are the same person. So we make decisions every day based on the way we are marketed to. It isn't a question of whether it's right or wrong. It's really a question of the psychology behind how people make decisions, right? So in these photos, which is the study participant and which is the consumer? And that's kind of the point. In fact, marketing is packed with well-established research on how people make decisions. So borrowing from this research can help us as researchers engage participants to a study, communicate more effectively, engage and retain the target audience so that you can improve health outcomes.
So one of the key tools to success in recruitment is how we communicate and what we say to our participants. And taking complex research language and making it simpler through important efforts like the Flesch-Kincaid grade leveling, or doing, not just translation, but back translation, writing with your audience's health literacy mind, is all important, but it's not sufficient. If we're not using language in the way our audience expects it and understands it, we're not helping them in making decisions about whether or not to participate. We are creating barriers to that goal. We need to keep it simple, clear, and understandable, but do not talk down to them. Remember, they are the subject matter experts in their own lived experience and their health. And so one strategy that we really like to employ is to layer the information we're presenting to our participants. We'll often start with basic study information presented visually, using simple infographics that show high-level concepts and break down the complexity of the study. We'll follow this with a consent primer to introduce the study consent process, what will be asked of them, and highlight the most important information that is contained in that informed consent form. And then this all leads to the actual informed consent, which sometimes even includes a companion video that introduces the investigators, gives a face to the study, and helps ease any confusion or concern about what's being asked. We can't always change the wording in a consent form or how long it is and how it's being delivered, but what we can change is how we layer and present information and study steps to make it less formidable. One of the other most common challenges researchers face in communicating with participants is how to address the barrage of acronyms. We often use acronyms to make things shorter, but if these aren't standard terms, they can create a whole lot of confusion. And even if it adds length and words to the study materials, they become a few pages longer, you need to take the time to explain the terms that you're using, help the audience understand what you're researching and why that matters to them. Hold on. So there's probably no better example that we can all relate to, especially when it comes to getting familiar with new terminology, than all of the language that we've learned in the past year around SARS-CoV-2, or should I say COVID-19, perhaps just coronavirus or COVID. You all know what I mean when I say we've become COVID literate this past year, but it was a process. We had to learn quickly not only what these new terms were and how we defined them, but also for us, how we explain them in a meaningful way to study participants who were rightfully much more concerned with their and their child's health than they were with terms like post-acute sequelae of COVID-19. So we had to work with our investigators to thoughtfully introduce this new language, layering the information until they were comfortable, to make terms like MIS-C, PASC, and others familiar and understandable to families, meeting them where they are in the context of their real lives.
So the bottom line is really this, right? So if you consider the audience before you start writing a word, you're going to have clarity around your research methods. Those research methods are going to help establish effective recruitment methods. And this is going to create a reality check on what's going to work, who needs to be on the team, and what kind of investment you're actually going to need as you start to budget. It's going to build a better partnership with the IRB, especially by creating your engagement materials early and with clarity, as Julia was mentioning, and signposting. And meeting recruitment goals results in better ability to prepare manuscripts and build success for your next study. And now we know that budgeting, and we've been through this many times, budgeting can make it really hard to think about investing early, and these quick timeline can make it hard to really think about how do you build this all and get ready to do this early in your recruitment process. But we have to stop and think that the long-term costs become really challenging if we don't do this step by creating team fatigue, resulting in endless IRB revisions, no cost extensions, and the like. So next slide. So considering your audience early and budgeting for them from study start is really going to avoid the common pitfalls, which result in 1/4 to 3/4 of clinical trials failing to meet recruitment goals, as I was mentioning at the start of this presentation. So this graphic really establishes why we've established these processes that focus on the audience so much, and why we advocate for starting early in the process. The lines represent study dollars dedicated to recruitment activities. So that's the framework. So consider the yellow line. A typical research study where there aren't a lot of budget dollars, resources, or input dedicated to conducting a needs assessment. We're not involving team members with expertise who understand the participants' wants, needs, and lived experiences. The recruitment investment is going to rise as the study team finds it's more and more difficult to engage the participants. The costs go up as new sites are added or new approaches are brought on to broaden the reach and exposure. Maybe the inclusion criteria have to change. Maybe they're revised, maybe they're expanded. This results in delays, revisions of the protocol, and the recruitment targets are missed, and the study is extended, but the finances, the budget, the team, all of those resources are often limited or exhausted at this point. Now consider the green line. In the proposal concept phase, there's investment in understanding the audience. The investment up front is continuous at a steady rate because the tools and the approaches are built in to match the known challenges and experiences we learned about the participants early. The study is able to avoid spikes in spending because the dollars were appropriated to activities that are going to create value to engage those participants. Perhaps decisions about inclusion were modified before the proposal was submitted, or the recruitment approaches were modified during startup when the stakeholder feedback indicated there were challenges, or the protocol was adjusted before it went to the IRB. This study completes recruitment on time, on budget, and with adequate data to meet your study aims. Next slide. So as we wrap up, I'd just like to share 2 final thoughts about why audience is so important from the very beginning through the very end of your study. The first thing is to say, give back. Every study leaves an impact in the community. It can be a positive or negative feedback, but it will always be remembered. So giving back has to consider the important constraints related to compensation. We know there are rules around compensating participants, but in our qualitative interviews over the years, we hear time and again that the participants never hear back from researchers. Participants are consumers, kind of going back to what we've been sharing. You get an email seconds after you buy those headphones wanting your opinion about how it went. Now that might be annoying, but you feel like someone wants to know your opinion. And you get a 10% discount for next time you shop. Maybe you'll never use it, and maybe you want to delete it because it's spam, but maybe you appreciated that savings on your next purchase. So even though we can't often provide financial incentives or personalized results, what if they just learned that the study was successful in meeting its goals and we thank them for their effort in doing that? This can be simple but thoughtful. This doesn't have to be complicated or expensive. Add it to your timeline, consider it as part of your study, and make it part of the study activities. So even if giving back is just recognition, don't forget about your audience. It could be a birthday card, and this is the example of a birthday card we've done. We've done holiday cards. You can do a thank you card. Don't leave them thinking, I wonder whatever happened with that study. So I think this is a very familiar thing. Once we move to publications, we forget about the participants who made the study, the data, and the publication possible. Most participants will never see a journal publication, so don't wait. Say thank you as part of your study. Altruism is often the reason people participate because they believe in the research, and we have to respect that. And finally, next slide. This is being human-centered. Keeping the audience in our minds throughout the entire study has important long-term impacts. It's something that all researchers know and understand, yet we sometimes forget. Research is the long game. It doesn't matter if it's a 6-month study, a 4-year study, a longitudinal study that goes on for 10 or 15 years. We are creating an impression in the communities that we work in. If we understand what the audience wants and needs from the beginning and throughout the study, we're going to engage with them in ways that they feel valued. We're going to engage with them in ways that they expect. So we have to create a study brand that's coherent, memorable, and represents their values and missions. And how we engage is how we're remembered, or not. So leave the field better than we entered it. Respect the audience so that when others come back, they remembered it was a positive experience. We succeed not only in the short term, but we leave the community open to future research. This is community-based, human-centered research. Next slide. So thank you for inviting us to participate and share this. And I think, are we going to move to questions?
I think that would be great. I'm guessing there are several. So yeah, we'll open it up to questions now. And first of all, thank you. That was, at least for me, speaking for myself, an incredibly valuable talk that is provocative and leaves me with lots of questions, but I'm curious to hear what some other audience members have to say. And feel free to put questions in the chat or to come off mute and just ask.
Hi, thank you. My name is Keku. So I'm an epidemiologist in the School of General Internal Medicine. And my original question had been sort of, around where we fit this in the budget, but I heard the answer as I was thinking it. But along those lines, in terms of saying that this planning ahead investment saves money down the line, do we factor that in sort of in the protocol development stage, where we say not only we're calling people once every 6 months, but on that first call, like I'm trying to figure out how to take this back to my team and say this is what we need to change to adopt what I just heard in this talk, and because in our regular, we're developing protocols to say use this tube to get this blood sample from this person, and that's the thing we're used to doing and we do that well. But I'm less clear about how to take this back to my team and like sort of actionable things. This is what we do next.
And it's a great question, and it is kind of, and I appreciate that you're really wanting to do that, because it really is a process of kind of relearning and rethinking. And I think one of the things is in that example, number one, you might start with, if it's a site-based study, you might start with asking your site coordinators or people on the ground who are working with your participant population, to ask them what are the things that kind of are difficult for them, or that they hear from their participants, their patients, about these challenges. So you can start really early in the study startup when you're getting sites on board to start asking them. You can ask, for example, as Julia had mentioned, there's some advocacy groups depending on your condition that you can start to engage them really early on, because they're going to be connected to your participant sample, and they can start to ask the questions that you might need answers to, or even ask questions that you don't know you need to ask. For example, kind of what are the biggest challenges they might have in X, Y, or Z, depending on what you're trying to solve. And then you can, another way is to really just take a little subsample of your study participant, depending on how much, like if it's a really small sample, rare and orphan conditions, that might be more challenging. But in a larger sample, you may be able to just ask through, like again, through advocacy groups or through the clinic sites that you're working with, to help get some direct participant feedback. Because the one thing that we do know is they're going to tell you. And this can be, this doesn't have to be a really structured qualitative study that has, thematic coding and all of that, because what you're trying to do is really understand what you're missing. So that's just some thoughts, and depending on your study, would be happy to talk with you more about that.
Yeah, and just to add to that on the budgeting, which I know you said that sort of was answered for you, is yes, we allocate every dollar for every test tube, and we need to allocate dollars also to these efforts, including the time to ask and the staff cost to involve them in the process, participant payments potentially. But if you do that at the outset, if you plan that you're going to need to spend dollars on recruitment, retention, engagement, giving back, you can build that into the budget, and you can think about those dollars, even if maybe you don't know exactly what you're going to do with them. Set them aside, plan for them, and figure out how you're going to use them as you move through the study. Because that's one of the great things about budgeting in the proposal phase is every single dollar that you're going to get for this project a lot of the time from the outset. And if there are no dollars there for any of those activities, it makes it really hard to do them down the road. So set them aside at the beginning. That's the time to do it.
And what about in terms of so approaching people, maybe subsamples like you mentioned, Lisa, is that allowed pre-IRB, or is that only after you've had sort of screening, and people are incentive? When does that, how does that play out?
That's a great, and I think some of the things that Julie was saying about bringing the IRB in early, because a lot of times what we'll do is when you have to do the just-in-time submission to tell the IRB the study is happening, a lot of times we'll engage with our IRB just to say, hey, you know, here are the things we're planning. And often we'll get approval for these very specific things while we're building all of the other elements. And we'll tell the IRB, we want to understand, we're going to do these, you know, 5 or 10 interviews, and we'll have a very brief set of, you know, informed consent forms for that exercise that doesn't have to kind of connect to the larger study activities, because then what you're signaling to the IRB is, we don't want to waste your time later, so we want to do this now. So you have to also, and I think to Julia's point, you budget a little bit of time in for that type of IRB approval and build that partnership so that you don't have to kind of wait for the, I kind of know exactly what you're saying, and the IRB process can be very time consuming. There's a lot of detail and a lot of approvals, and that process takes a lot of time to build. But you can work with them to kind of take steps towards that and not have to have it all combined in one submission.
The other thing that can be helpful, depending on the circumstances, is a lot of the time this isn't the first time we've conducted a research study with this population. And so we often do play that long game. And, you know, in the consent process for the current study that's ongoing, we ask if we can contact them in the future about other opportunities or about other activities that may not be, you know, part of this research study. And then we may reach out to them in the proposal stage as partners, not as study participants, to create an advisory board of people in this population who won't be part of this next study, but can bring that target audience perspective to both the study design and the recruitment processes. So sometimes that works, not always, but thinking about that long game, as Lisa said, can be helpful too.
And that's where also you can start to kind of plan for talking to your participants, but also that's where you can talk to your site coordinators, you can talk to advocacy groups, and you can do that without IRB. So you can kind of start to do some of those things without, as you're kind of building towards this. So.
Thank you.
I have what I think is a follow-up question to this. I have a good friend who's an astrophysicist, and so he tells me all about astrophysics. And one of the things that's different about that field, the way he tells it anyway, is that there's kind of a distinction between theoretical physicists and experimental physicists, right? So there's the theoretical people working out the hypotheses, figuring out what the science is. And there's the experimental people who are kind of getting down in the dirt and figuring out, okay, well, how do we actually make this experiment happen, right? How do we put together the particle collider or whatever it is that they need? And it seems to me that you're certainly outlining skill sets that you've got me agreeing that these things are important. I see the need, that kind of thing. And yet it gets into marketing and operations and language and, you know, digital technologies and stuff that goes beyond my expertise. So I'm thinking, well, either I develop that expertise, or I get a staff member or a co-investigator develop that expertise, or I start to engage with others who already really kind of have this expertise and it's their profession. And, you know, it seems like you guys kind of fill that role. So I know that the BU CTSI has a relationship with the New England Research Institute, but I'm just kind of wondering if you could say anything more about that, or more general advice for engaging people who really have this at the center of their professional skill set.
Yeah, I'll talk to that in a couple of ways. I think number one, when I started building the digital strategies research unit at NERI, we had video developers, we had website developers, we actually had a team of technologists and video folks on our team. And over time, what we decided was that what we wanted to build was strategic partnerships with groups that do this at the highest level all the time. So our business unit has people who really understand and speak the language, but the actual kind of doers are vendor partners who we go back to. We have, like I said, strategic partnerships so that we can call them up when a proposal is due in 3 weeks and say, we need X, Y, and Z, because they understand our business, they understand the health field. And so we have them in web development, in video, in branding and design. And that really helps get you where you quickly where you need to go with people who understand what you're doing. So one of the things I would say is start building strategic partnerships, because there's no reason to build that skill on your team. Your team already has really important expertise and they don't need to learn how to do these other things. We also have learned, because as we know with a lot of federal funding, the terms marketing are kind of taboo in funding. But there are, I mean, when we are talking about a participant and a consumer and marketing, really about engagement, we just work around, and then, like I said, these strategic partnerships help us do that, kind of do the work that we need to do, and make sure that we're using the terms that make sense to our funding audience, our stakeholders, our participants. So so that's how one of the ways we've addressed it. And I think the other thing is, you may have people within your organization that have these skills. It may be someone on your team who likes to build websites on the side, or you might have team members in your in the marketing and communications team that have never thought about participating in research. So just think creatively about where those skill sets may exist, and bring them into your study team early. Oh, you're on mute.
I am on mute. I want to pause for a second to allow others to ask questions if you have any. Otherwise, I will follow up. Any other audience members have questions? Then, I'll ask, do you have, it makes me wonder if you have any sort of cautionary tales. People trying to do this kind of half-heartedly, you try to incorporate a Twitter thing in your whatever, and it's a little mismatched, and it was never a good idea in the first place, and the technology doesn't work out, and it just ends up delaying things, or you know what I mean? So I feel like you're kind of laying out best practices, and I'm imagining the old metaphor of you're walking down a road and it's good to be on one side or the other side, but you really don't want to be in the middle. Does that sort of apply here?
I think that's a great analogy, and interesting. So the reason that we established this, and we were at, in our organization, we sat, across the hall from our clinical research teams. We did research ourselves. And so early on, and the reason that we built this team and these processes was because we would be invited into a grant that was 2 years in, missing recruitment goals, struggling to hit targets, and they would say, help. We need a website, or we need a brochure. And we were coming to it trying to rescue grants to meet those, and these clinical trials were really trying to beef up their recruitment. And exactly to your point, they had spent a ton of money doing X, Y, and Z. A lot of times they would say, we need a WebMD campaign. And the point was, you can't just jump in with a WebMD campaign if it's a clinic-based sample who really needs to be in a doctor's office and is referred from another provider. You'll spend $50,000 to $100,000. You'll never get a participant recruited. So what we started to learn is that, why don't we talk to our clinical researchers early, and what I think we did presentations, and we showed why there was value in doing this way. And so they started building us into their grants from the beginning. And so to your point, Chris, it's we have a lot of examples of how that would happen, is like, we need this thing, we need a website, we need, and our question back, when they only had like a handful of dollars to spend at that time, is a lot of times we did whatever we could to help improve their recruitment with the money and the time that they had available. But we also learned that we really need to start further upstream so that they can avoid that in the first place.
Yeah, and I think, we've certainly had some cautionary tales. I would say the only thing, worse than maybe no social media in some cases is stale or wrong social media. You do definitely have to be thoughtful and make sure that there's a reason behind and a strategy behind everything you do. You can't just, slap a Twitter on it and solve the problems. You've really got to think about the audience, where they are, and what you want to say to them, and how to communicate with them in a way that makes sense for them. But a lot of our participants are participating because of altruism, and in fact, maybe more forgiving than standard consumers in that way, that, don't be afraid if you're, trying something new. Maybe don't put all your eggs in that one basket the first time around, or bring in a professional the first time around to try it out. But they'll understand that you're making the best efforts you can, and it may not be the $100,000 marketing campaign, but that you're doing the best that you can within study means to try to reach them in the ways that they'd like to be reached.
Okay, so that's very helpful, and I guess I'm two of the things you've said a lot of things, but two of the things I'm taking away are, to use sort of medical terms, that premature closure seems to be a problem, right? Like selecting selecting an intervention or a treatment or in this case, a recruitment strategy before you've really done sufficient diagnostics to figure out, is this, do you really understand the problem and is this the right fix for that problem? Is that a fair characterization?
Exactly. And that's why I like to show the example of if we define our audience by words and then we show pictures of who they are, we've narrowly defined an elderly male HIV audience. But if you look, every single one of them are going to be different in how they show up and what their needs are. And when you understand that, transportation may be an issue. Their cultural background may be something that you have to factor in. It's not just about study logistics. We're going to get Uber and we're going to bring them in. I mean, maybe they are concerned about Uber as safety, and maybe so. You really have to think about all of that and really understand it before you make those decisions, because that's where things fall off. You may get the first group in because they're the easy to reach, and then you drop off because the harder to reach participants aren't participating.
And in terms of investment, just like we talked about layering information to help participants understand the study, layer your strategies and, invest small and see what's working and not working and, pivot as needed. A lot of the time, if you dedicate those dollars and you have them there to figure out the right approaches as you start to move forward, you can quickly identify what's working and not working and have that cushion there to make sure that you can correct the approach as you need to once you get started. That's a lot harder to do when you're scraping dollars down the road when things start to fail and you need a solution very quickly. Starting early is definitely one of the key takeaways.
And I think related to that, and what's really important is one of the ways that you actually do save money in these campaigns is by being thoughtful up front of all of this, because you don't have to do, like, print is not dead, but it's not the number one approach for a lot of audiences, right? So you can do something that's print, that's digital, that might become part of a PSA campaign, an advertisement, and it's all the same content. And it might just be truncated. You might be focusing on different aspects of it, but you don't have to create it over and over and over. You create it once and then you fit it to your type of tool that you're going to use to reach out to your audiences. And that way, having those teams on who have that expertise can say, this is the core message you want to say. Now, how do we frame it for a 360 character piece versus a print piece versus something you might mail out? So.
I keep wanting to leave space for people to ask questions, but I don't see anyone coming off mute and I don't see anything in the chat. So as my friends and family know, the best way to get me to stop asking questions or stop talking is to interrupt me. So I invite anyone to do that. Barring that, I'll say that I have a couple roles here, and others in the call, for example, Keiko will as well. One is as an investigator, and as an investigator, I'm both, I don't know, very interested and motivated, but my head is a little spinning. There's a lot of things to really get on the ground here. But luckily, the other role is with the BU CTSI. And it makes me wonder, how much of this do you think is best implemented really kind of at the individual study level with different investigators going out and developing these partnerships and figuring that out? And how much of it is probably better really created at the institutional level? And again, not to bar options for individual investigators, but to create options at a kind of more streamlined path. Can you comment on that a little bit?
Definitely. I think that kind of going back to that layered approach is probably applicable here. Don't try and boil the ocean in some of this stuff, because these are really hard concepts that we're trying to change the way people think about conducting research that has been conducted one way for a really long time. So appreciating that, it's probably kind of a multi-layer. The institution, number one, has to support this approach, right? Because when you're putting in a grant and you're trying to get grants funded, you have to think about allocating dollars, and we might be, thinning dollars here to push them up here because we know that the long-term costs and the long-term gains are important. So having that institutional support is really important. Doing things like this are really important to help educate why it's important. And then at the individual research level, I think what Keiko, you were saying is, how do I bring this to my team? And maybe you start with this study. Maybe you're just starting up a study that's already in the field. Don't say, well, we're not going to worry about that now because it's too late. Think about, how do you carve out something now to start building that into the project you're working on now? And then the next study, think about building it in up front when that next deadline comes around in September, when we're all getting ready to go back after summer So I think it's a layered approach, and it's also be patient with ourselves and our teams as we build into this, because it is something that takes a little time. And research is the long game. So that is why starting now in little ways and building on that over time is really going to make a stronger research portfolio for everyone.
So we have a specific example of a study that's going on in St. Petersburg, Russia. You know, we just sent in the JIT. We're hopeful it's going to get funded, and everybody fingers crossed, yada, yada, yada. It's a team we've worked with for about 10 years. This particular study is an inpatient TB study where, in my head, when I was writing the grant, I was like, oh, I mean, a huge apologies for the term, but this is a captive audience. You know, they're in TB treatment in the hospital for, 3 months, right? Like, I don't need flyers, I do my pre-screen, right? And then the person who's in the hospital is going to go to the person's bed and say, hey, we have this thing, do you want to get in? And we're careful about the language, and that we have our pre-screen, our screening, all that. So, in my thought process, am I missing something where I should have come to find Lisa and say, this is the thing I'm thinking about. What am I missing? Like, what am I not thinking about here? I mean, and the hard part of the study is once they leave the TB hospital, we want them to come back, every 6 months for 2 years, something like that, right? And we do want to create the engagement in that hospital so that we increase the likelihood they come back, but in my head, it's like once they're enrolled, we'll just keep calling them, and we've got 2 points of contact, and we've done the work, right? But clearly after this presentation, I am missing something, and I would like to figure out what is that, right? And who should I send you an email, Lisa and Julia, to ask that question?
Well, we'd certainly be happy to talk to you more about that, because I think, first of all, that's a super interesting study. So good for you, and good luck. I hope that it all goes well. The other, but the piece of that, I think, is you're doing all the logistics right. You thought about every step of the process. But the one thing I think that, just quickly hearing what you're saying is, when they're in their hospital bed, are there things we're not thinking about that make that hard for them? Or why would they do it even if they're sitting? Maybe they don't want to watch that thing. Maybe they want to watch something else. What's in it for them? Why do they care? And then to your point about the long-term engagement, if you even get, and we've experienced this, where you get really good engagement up front, but you want them to come back or at least do something like 6 months from now and then 6 months after that, what have you given them in that first experience that makes them feel like you care? You're not just trying to get a number, and that you want to engage them over time. So they're like, wow. And we have a study that went on for a number of years, and we had participants who said, I've been waiting for you, because we would send them birthday cards and holiday cards every year. So it's really about making sure they feel like they are valued by you, and then they want to see you again. And I know we're at time, so I know that's that's one answer, but we can certainly talk more, and feel free to reach out to us directly.
That was super helpful. Thank you.
Oh, well, with that in mind, thank you very, very much. And as you say, research is a long game and much longer than this one seminar. So we do hope to be in touch. And thank you very much. This, for me, has been invaluable, and I suspect for many others as well.
Thank you. We enjoyed it.
Thanks so much for having us.
All right.